I am Mariska van Steensel. I'm a BCI researcher and an associate professor at the University Medical Center in Utrecht. And at the Department of Neurosurgery of the Brain Center, I coordinate much of the brain-computer interface research. So in this intense project, we try to accomplish control over digital devices, such as a computer, by using brain signals only. And this technology is called the brain-computer interface. So with a disease such as ALS, for example, people progressively lose the ability to move and also the ability to speak. And losing the ability to speak really has significant consequences for how you can actually participate in your family life, how you can manage your care even. People start to look at you differently. You may be left out or maybe too slow in conversation. So that's really has a profound effect on your participation and your quality of life. And current technologies, they help people with ALS to communicate, but they do not work in all circumstances or in all disease stages equally well. And we hope that BCIs, because they enable brain-based control over communication technology, we hope that BCIs could provide a solution so that people with ALS can actually participate to the fullest extent in society and daily life and their family life. One of the big goals of our research group is really to enable participants of our research to use the systems without us being there at their home. We find it important because we want to try to offer a little bit of benefit, although we cannot promise it. But the other important aspect is that only when people start using the technology without us being there in their daily life, you will encounter what factors play a role in the performance and the usability of the system. Our dot on the horizon, our long-term vision for this technology is really that people with motor impairments fully participate in society without limitations. And we've been in this field for almost 20 years, and already 10 years ago we implanted our first participant. We worked with our first candidate for more than 7 years. He used the technology at her home, but that was a very basic technology. Nowadays we have access to more advanced devices that allow us to test and demonstrate better functionality of BCIs. And beyond that, and to actually get to the dot on the horizon, we will also need to conduct larger studies with more participants so that we can understand what factors play a role, for whom precisely this is the perfect solution, and to actually demonstrate the benefit and the impact on those larger groups of patients. For this technology to be eventually widely available for people with motor impairments, it's very important that it gets reimbursed. And to that purpose, the BCI community is currently exploring and discussing heavily what metrics, what measures we can use to measure the impact. Because eventually for health insurance, we really need to demonstrate the benefits of BCI technology for patients, but also for their caregivers and hopefully for society at large.